It's World Hypertension Day today, a day set aside to raise awareness on the prevention, detection, and treatment of high blood pressure. Hypertension is a major health concern and has been described by the World Hypertension League as a leading risk factor for death and disability globally. To combat hypertension effectively, countries are implementing evidence-based strategies and setting national targets for improved management within primary healthcare. Efforts include aligning clinical protocols with the WHO Heart Technical Package, introducing team-based care, and enhancing access to essential medicines. Key actions focus on reducing risk factors, accelerating management coverage, monitoring progress, integrating with other national health programs, as well as empowering communities for self-care. And for more on this observance, let's speak with Public Relations Officer, Association of Public Health Physicians of Nigeria, Lagos Branch, Dr. Blossom Madufukwa. Dr. Madufukwa, thank you for joining us on the news this hour. The Nigerian Hypertension Society says 1 out of every 3 adults in Nigeria is hypertensive, and it's called now for the need to raise awareness, promote prevention, early detection and treatment, and what have you. What would you say is responsible for such prevalence, and how is that figure faring when you compare it with the reality across the world?
Thank you so much for having me. So the figures are exactly as you indicated. Like all over the world, up to 1.28 billion people have hypertension, and most of them don't even know that they have hypertension. Some of the things that are driving the increased prevalence is the risk factors, like you had alluded to in your introduction. So some of the risk factors: increased salt intake, increased stress, smoking, abuse of alcohol, lack of exercise and physical activity, overweight, obesity. We know that right now there's an overweight and obesity epidemic all across the world. So these are some of the risk factors that are driving the increase of prevalence of hypertension all over the world, and particularly in a low middle income country like Nigeria. The problem tends to be that people tend to have different health-seeking behaviors because of the financial implications of going to the hospital. So people tend to sort of stay away from the hospital, if you understand what I mean. So because of it, hypertension in our part of the world is really detected very, very late, and people tend to present with complications when we see them for the first time.
Well, the figures are troubling. High blood pressure is linked to more than half of deaths from heart disease and stroke. And we're told it
Correct.
Develops silently without the person even coming into the awareness of what's happening. Speak to us about what we need to look out for, particularly what are the early signs, of hypertension that everyone has to be aware of.
So I love this question. The reason I love this question is because it speaks to exactly why we keep stressing on people getting their blood pressure checked. Hypertension is called the silent killer for a reason. It's called the silent killer because it has no specific symptoms. So just like you asked also, what are the symptoms that people can recognize? There are none, actually. That's why you have to have your blood pressure measured. It's a silent killer because your blood pressure will be high, but you can't tell. Sometimes you could have headaches, chest pain, but these are non-specific symptoms that you can have with so many other diseases. So the only way to actually identify hypertension is to have your blood pressure checked, which is why the theme for this year is extremely important. Measure your blood pressure correctly. So there are no specific symptoms. You just have to have your blood pressure checked.
Measure your blood pressure accurately, control it, live longer.
Accurately,
But
correct.
what do you consider the standard practice in this regard to make accurate blood pressure accessible and making controlling it affordable?
Oh, great. So there are ways you can do this. For people that can afford it, it's readily available at any pharmacy. Your blood pressure measurement equipment, we call it the sphygmomanometer. You can go and purchase it and use it for yourself, or you can walk into a health facility. You can walk into a pharmacy, a clinic, and just ask them to measure your blood pressure. They don't need to charge you anything to get that done. So this can easily be done. When we say measure your blood pressure accurately, there are ways that it can be done. If you do have your own measurement equipment, you have to make sure it's a validated one. There are really good ones that you can purchase for yourself. When you measure your blood pressure, you need to be sitting down. Your arm needs to be at rest. You don't speak. You don't have a conversation because it could affect it. And you make sure that your feet are flat on the ground. Your back is straight back on your chair while you measure your blood pressure so that you can get an accurate reading. If you're not able to do this for yourself, you can walk into a health facility and have a health care professional do it for you.
Public Relations Officer, Association of Public Health Physicians of Nigeria. Dr. Blossom, how do you pronounce your surname?
Madra Fokwa.
All right, since we are measuring blood pressure accurately, I thought we should also get your surname accurately. Thank you so much for talking to us.
Thank you so much for having me. It's my pleasure.
Now, the Nigeria Institute of Physics